what do people need to know about vision health?
There's several things that we have been told, right? We've been told, first of all, that your vision always can only get worse. And maybe your listeners have noticed that their vision varies too, that it's sometimes better, sometimes worse. Most people notice, like you mentioned in the beginning with screens, after a long time on the computer, it gets worse. But vision is changeable and can be getting worse and better. And your own habits and your lifestyle is basically, I would say, I don't know the exact percentage, but like think of 95%. Most vision problems have nothing to do with genetics. Like people are always told it's genetics, it's age. It's really way more your lifestyle, right? Your sleep, your diet, your vision habits, the techniques that I teach, that's really what it's based on. And yes, there is some genetics and usually eye diseases, that start in childhood. But most of the vision problems and statistics can show, when you look at statistics, how the rise of nearsightedness has gone up since the 70s from about 25% in the States and about same thing in East Asia. And in East Asia, it's now over 90%, 90, right? That's not genetics. That doesn't happen that fast.